think that's fine. And just to say a massive thanks to CDC for having us here today to talk about ELSEC, and a massive thanks to Georgia and to Marion from Barnet for taking the time to join us as well. They're incredibly busy, so we really value them being here. I'm just going to do a little bit of background about ELSEC. So this is, for those who don't already know, it's a jointly funded programme between DfE and NHSE, just under £10 million over 2 years, whereby we're testing innovative workforce models to more quickly identify and support children and young people's speech, language and communication needs at universal and targeted level. And it's going to be operating in 9 pathfinder sites in early years and primary settings. The basics of ELSEC is that we fund ICBs, who then themselves fund teams of speech and language therapists, who then train pre-qualification speech and language assistants. These teams will work with clusters of schools within Pathfinders to deliver screening and low-level speech language communication interventions with individual children or groups of children. This is with a view to reducing the rates of specialist referrals and or more appropriately referring children to more specialist speech and language provision. This is as you'll see, there are 4 main ambitions. So it's to improve the identification and support for these children. They're in reducing the rate of specialist referrals. We know that community wait times for community services across speech languages, paediatrics and OTs are massive. So that's something we're trying to grapple with. It will help try and reduce these by increasing the workforce capacities, utilising those teams of which Sophie will come into a bit more detail on in a bit, and improve the quality of data and evidence, and importantly, improve the join up between health and education, which we know which is vitally important. If we move on, I will just very quickly say a little bit about the how the ELSEC fits in. So the DfE funding for this is, as I said, it's jointly funded, 50% from DfE, 50% from NHSE. The DfE funding is wrapped up as part of the change programme, which Amanda touched on earlier, which is looking at 4 system level reform proposals, including the enablers, ordinarily available provision, EH and national standards commissioning. And ELSEC sits firmly in the testing and learning around what's made as ordinarily available provision. I think it's just important to say that this is the change programme in its current form, but this is the legacy of the previous government, and what happens next remains undecided about the change programme. Obviously, ELSEC will run until April 2025, with Pathfinders delivering until August, but we don't know yet exactly what the future of ELSEC and the change programme will be. So that's just a little bit of context. The big picture stuff. I'm now going to pass over to Sophie, who's going to talk a little bit more about how the Pathfinders operate.
Great, thank you so much. Tamara, could you move to slide 4? Great, thank you so much. So as you may, sorry, I'll just introduce myself quickly. So I'm Sophie Hale, I'm the Programme Manager for ELSEC from NHS England, and I sit within the Community Health Services team. As you may or may not know, there just aren't enough fully qualified speech and language therapists to meet the current demand. So the main focus of this pilot programme, or the innovative aspect, as Tristan said, is on recruiting pre-qualification assistants into that workforce. The idea is to learn on the job, gain their qualifications, and support with the specialist caseload, which then ties into the second aim around reducing specialist referrals. Here's an example of the workforce model that we initially proposed. However, each of the sites, there being 9 of them, has adapted this model to suit their local need and existing workforce structures. We have stressed the importance of flexibility throughout this programme. ELSEC is intended to support and embed into existing instructions for SLCN is for supporting children and young people rather than, ripping everything up and starting again. So if you'd like to turn to the next slide, please. Thank you, Tamara. Thanks. So just in terms of our main main theme for this presentation was around health and education collaboration. So this is just a little diagram in terms of how we are embedding that at every level. So at each level of the pilot programme, we have set up governance structures to facilitate as well as encourage collaboration between health and education from the national team. So myself and Tristan are part of the ELSEC national team, and we meet weekly, to the regional. So that's consisting of the integrated care boards, local authorities, and then beyond, such as trusts and providers. And then in terms of the collaboration between settings and their staff, parents and carers, and the ELSEC workforce itself, this is on a local level. We also have a reference group for ELSEC, which acts as a critical friend. So its membership consists of Royal College of Speech and Language therapists, head teachers, advisory teachers, lived experience and parent care reform representative. And this sort of ensures that we are, including different perspectives and collaborating to make sure that this programme is effective. If you want to move to the next slide. Bit of a Chris Whitty there, sorry. Thank you, Tamara. Great, and then just the last slide from me. So on this side, we have a map which lists all of the 9 Pathfinder sites across England. As you can see, there's one from each of the DfE regions. And today, as Tristan has said, we are joined by Georgia Roskin from London Barnet Pathfinder to talk to us more detail about the practicalities of setting up ELSEC and sort of how it's getting on. So without further ado, over to you, Georgia. Thank you.
Thank you. Thank you so much for having me today. It's great to talk about ELSEC and Barnet. Could I have the next slide, please, Tamara? So Sophie shared what NHS and DfE shared at the beginning of the project in terms of their idea for the workforce. In Barnet, our team looks as the following. So you have myself as the clinical coordinator, we have 1 other speech and language therapist, and we have 6 speech and language therapy assistants. We also have an admin data lead, and the project in Barnet is we have a steering group who helps guide the project and how we move it forward. Can I get the next slide, please? Thank you. So just to share about our overall pathway, in the first visit, prior to the first visit, we ask all settings to send out a survey to parents to gather their views. Then we hold an initial meeting with the therapist, one of the assistants, the Senko, and key members of staff. Then we walk around the school, and together we come up with a plan for how best to support that setting. Then we have then the speech and language therapy assistants go into the school for 6 visits, and the therapists oversee that work. What we've really found, and what schools have really responded well to, getting the most out of those 6 visits, but then being reassured by the idea that we are going to follow up with them. So then once we've finished their block of support, the teaching team continue to provide the support that we've helped them to set up. And then we carry out follow-up visits to review the setting's progress. Staff are also invited to attend online supervision or support sessions, with again the idea being that staff members can support each other to problem solve. Overall, I think if we kind of move to the next slide, we're really thinking about sustainability and how we see ourselves in ELSEC as setting up support for a setting and them being able to get started, rather than a reliance on speech and language therapy. Could I get the next slide, please, Tamara? Thank you. So that's really our key focus, is sustainability. We want to support schools to change their culture and embed language support for children just as part of business as usual. We are trying to work really flexibly with each setting and agree how the programme would fit best in their setting with staffing and school priorities. We're really keen to have ongoing communication and partnership with our colleagues within the local authority, and Barnet Parent Care Reform have really supported us and steered the project. Could I get the next slide, please? So I came into post in April 24, and we started a trial, a pilot, in June 2024. We had 3 schools who were involved. They completed expression of interest forms. All schools engaged in an initial planning meeting with our team to decide priorities. All the schools opted for support in their early years settings, but like Sophie and Tristan have shared, ELSEC is also for Key Stage 1 and 2, but these 3 settings wanted support in the early years. So we supported them with screening support, so looking at their whole cohorts and finding out who has communication needs within their cohorts. I always get asked, what screener did you use? We've created a locally developed screener because we wanted to ensure that it could be used with children who speak English as an additional language, and that it's functional. We found when we looked at lots of screeners that they were very lengthy and they weren't really looking at functional communication skills. We also provided lots of support around how to develop the setting's communication environment. And again, we adapted a tool that was already developed by the Barnet service, and this was something that was done collaboratively with the staff in the setting. And we spent a lot of our time doing adult-child interaction video coaching. So this is based on parent-child interaction approach, which there is a really high level of evidence for, and it fits in really nicely with the statutory framework. And one school opted for an additional targeted group. Next slide, please, Tamara. Yes, this is just a bit more information about the adult-child interaction video coaching sessions. And we really supported staff through feedback and coaching to upskill the staff to use a new interaction strategy each week. And then they would practice the strategy each week. And this was very popular with these 3 settings because the teaching staff didn't need to leave the classroom. They didn't need to do like an additional targeted intervention during the week. It was just something they would be using within their everyday practice. Thank you. Next slide, please. I really like to provide some visuals because I think that brings it to life a little bit. So you can see on the left, and we've got a picture of a group intervention we ran, which focused on supporting the children to learn new concepts. And on the right, this picture is taken in an outdoor area within a school that previously was not used. It was kind of seen as dead space within the school. And we worked with the school to think about how they could develop it to encourage children to talk more, develop their communication skills when playing outside. As we know that often outside children run around and ride their bikes, which is absolutely fine, but we want to encourage communication as much as possible. So they created Superhero HQ for their reception class. And I'm going to be honest, they didn't have lots of resources from the school within the school, but they were really creative. They found kind of things that were lying around and printed out pictures, in order to bring their space to life, and they said that lots of their children were starting to use that space and role play outside, which was exactly what we wanted to happen. Next slide, please. So we have some data from those first 3 schools who received the supports. So 270 children were supported through our universal offer, with 6 children being supported through our targeted offer. The schools that have signed up for September have said that they would like a larger targeted offer. So we know that these numbers will increase. Again, this is around us really being flexible to schools and not saying you have to, ensure that this many children receive targeted support. It's great that all the children received support, and we supported 23 staff members. Staff feedback provided some really lovely qualitative data that highlighted the impact of ELSEC support. So they reported improved interaction. Lots of the staff members said that the coaching has helped them engage more effectively with children by using strategies such as pausing and waiting, reducing questioning, and allowing children to lead conversations. Staff said that they have increased awareness, they're more mindful of their interactions, focusing on using specific strategies, like getting down to the child's level, waiting, and allowing children to process and respond without interruption. They also reported positive outcomes for children. They found that taking a child-led approach resulted in children being more articulate, confident, willing to communicate. Staff also told us that children are happier, more engaged, able to lead the play and have conversations without feeling overwhelmed. As the project continues on, we will be gathering more quantitative data on the children's progress and the impact on the children's speech and language skills, but we don't have that just yet. And finally, staff reported it really impacted their personal growth. They said that they've really learned from the coaching and they realised the impact of these strategies on their own practice and on children's communication and language development. I think I have yes, thank you. So we've learned a lot so far from our pilots. We've really seen positive change in staff's use of strategies during video coaching sessions. We've seen improved communication environments in the classrooms and staff enthusiasm to continue from September. And we've had really positive feedback from staff, particularly around the collaborative approach. Some of the challenges we faced have been thinking about what is appropriate for a speech and language therapist to do versus an assistant, and thinking about the remit of their role. Of course, there are only 2 speech and language therapists within the team, so we really have to think about that and how we manage that. We've also really reflected about ensuring that we're providing targeted support for children who would benefit most. And that's mostly been around ensuring that staff screen children as soon as possible so that we can then ensure the correct children are receiving support. We've also had lots of challenges around screening children who speak English as an additional language. I don't have all the answers to that just yet. It's something we're working on. And another challenge has been schools reporting difficulties around staff capacity and cover in order to be supported by our team. Final slide for me, please. So next steps. So as you can see, we had the pilot in June and July. Then over the summer holidays, we've been providing additional training for our assistants. And that has been a kind of theory-based training as well as on-the-ground training. So we ran some summer targeted groups, which helped them to learn about some of the interventions and practice running them. Right now, the assistants are working in pairs to deliver interventions across 6 new settings. with the therapist overseeing and supporting. We're also doing follow-up visits for our pilot schools. And from November, the assistants will be delivering the support independently in settings with oversight from us.
Great, thank you so much, Georgia. I'm just double checking my mute has come off. Great. Great, so that gives us about 7 minutes for a Q&A. If anyone has any questions for either myself, Tristan, or Georgia from a locals perspective. Hi, Amy.
Hi, I've got a couple of questions if you don't mind.
Yeah, sure.
The first one is the assistants. What sort of training and qualifications have you put those through to be able to carry out the interventions with the children?
So understandably, they are, as you know, they are pre-qualification. The idea was not to take from one aspect of the system and put it to a different one. We wanted to avoid that. We've developed as NHS England, along with other other organisations, developed a workforce training planning tool. We're basing that on the SLCN framework, as well as other areas, ad hoc training, shadowing, that kind of thing. It was down to the pathfinders to decide which specific training they would like to engage with. So the qualifications might differ slightly just depending on what their local needs are, that kind of thing. We have a couple of the Pathfinder sites where the ELSEC lead is actually from Speech and Language UK, and they're looking a lot into the level 3 qualification and that kind of thing. So it's flexible, as I say. That's the main focus of us. I didn't know, George, if you wanted to come in on that from a Barnet's perspective, if you are happy to.
Yeah, I think you've given a really good overview, Sophie. And I guess Sophie said it really has to be tailored to each pathfinder. So in Barnet, we've been providing training around the specific interventions that they're going to be running, but I know that around the country that's been different because they're running different interventions. So we we're doing a mix really of what I would call on the ground training and the theory side of things.
Thank you. And then just one other question, if you don't mind. You mentioned a couple of the challenges that you're facing, and one of them is about what's appropriate to ask the assistants to do with the speech language assistants, and then about capacity and cover. And I just wondered if you'd started to look at that and what you're doing to mitigate that.
Yeah, absolutely. Yeah, no, we're not just leaving challenges to the side. We're definitely trying to work through them. So we really look at kind of each step and think which things can, an assistant do versus a therapist. So we've really found that in the setting up, so getting resources ready, getting packs ready, that has mostly been the therapist completing because we have the qualifications to, get those together. And then the assistants do the side of things where it might be then making that into a laminated, pretty looking resource. But then the kind of on the ground stuff would be that. So myself and the other therapist are doing more of the work around screening the children and supporting staff to screen. We're kind of at the moment really helping the assistants to help the teaching assistants with that side of things, and things around the work that involves working with teachers. We feel again that's where a therapist needs to be more involved, so giving advice around the classroom environment. We feel that's where the therapist needs to be more involved. But since September, we have been doing it kind of collaboratively with the assistants. So we've been there as a therapist, but the assistants have been also sharing ideas. And it might be that as we go along and the assistants become more experienced, they're able to take on more and feel more confident with certain things. The other thing which we're holding as therapists is the parent support side of things, which I didn't go into too much detail about today, but we feel that that's where therapists need to answer those, hold those coffee mornings or drop-in sessions, because if I'm honest, parents ask more unpredictable questions and are more challenging to answer, whereas the assistants can follow session plans and run things with teaching assistants. That's within their job role.
Thank you.
Thanks, Amy. there any more questions? No. I've answered some questions in the chat. Do let me know if they're acceptable. And yeah, I think that's it, Amara. Great, thank you everyone for coming. Really nice to have you. I'll pop my email in the chat in case anyone wants to get in contact with either myself, Tristan, or George. I will triage that email.
Thank you.
Thank you so much.
Can we just say a
Thanks.
massive thanks to Georgia
Thank
and
you.
Marion from Barnet for coming.
Yes,
Thanks so
thank you,
much for
Georgia.
being here today.
Thanks so much.
Cheers.
Thank you.
Thank
Bye.
you.